All right, all right, all right. Welcome to the hottest show on the planet. I see Gray with class and with the Community Coalition. Sounds so sweet, doesn't it? I love it. I'm here with the regular guests, not regular guests, regular hosts, except for one, Bronco McCart. Salute to you, my brother, wherever you're at. I love you, man. I got my sister. I got Chantel. She only goes by one name, Chantel, like Beyonce, Chantel. And I got my brother, my older brother. I love him to death. I love him to life, I should say. I never say to death. Always remember that. You love people to life. You want to breathe life into them. You want to say you love them to death, right? I don't do that anymore. I love you to life. It breathes life into it. And our super guest, she's not just a special guest, she's a super guest. And I tell you, when you talk about people in our community that doesn't get the recognition they rightfully deserves, who really works hard behind the scenes and make things happen, I couldn't be talking to more about this special woman that I've met during a community coalition. She does so many things. It's just amazing the work that she does. I'm proud to call her friend. I'm proud to call her one of my what we call classmates now, Chantel, classmate in the coalition, classmates in the coalition.
I think
I
she's
like
younger than us, though, I have to say.
Yes, it is the one and only
Yeah.
Crystal Palmer. Welcome to the show, Crystal.
Thank you.
We've been here 8 years. I'm surprised we haven't had you on yet, but we having you on at the right time. There's a lot of special things that's going on with CMH. Please introduce them to you, introduce the people to you. Let them know what you do, and let's talk about everything that's going on.
Sure. I'm Crystal Palmer. I am the Chief Clinical Officer at Monroe Community Mental Health Authority. I've been here for the past 3.5 years, and prior to that, I worked in Wayne County Mental Health for 20 years.
Nice.
Go ahead, Chantel. I see you ready.
Okay, well,
Go ahead. I don't want to step on your toes.
No, that's great. Can we just start firing away questions for Crystal?
Yeah, Crystal. So what's been going on with CMH? I know today, which I'm very proud of being. I wish we'd had this show earlier because we could tell the people to go, but by the time this comes out, they're going to miss the town hall meeting. But I've noticed this town hall meeting been going on for past 10 years or more, for what I've heard. And I'm blessed and honored to moderate the town hall this year at CMH. Can you please tell us a little bit about the town hall meeting and what's it for, and other things that's going on at CMH that you're in charge of?
Sure. So today, like Aaron said, is the town hall. It is from 3 to 5 at CMH at our Raisonville location. Our town hall is typically an opportunity for us to kind of review the year, things that have been going on, kind of honor some of our consumers, our stakeholders in the community. And also this year we have Alan Bolger, who comes from the state, coming in to talk a little bit about kind of the state of mental health for Michigan. So not just focusing on Monroe, but focusing on the whole state, where we're headed. And this also gives an opportunity for community members to come in and ask questions, share their feedback on services.
Yeah, that's great. We just had Lisa on not too long ago, and she talked about all the wonderful programming that happens there at CMH. What I really appreciate being a part of the community coalition is you guys have the data to support whatever you're talking about. And I think that's so important for the community to know the data in which CMH operates. It's not just something you're just throwing out there, but work is actually being done. And I think the community really doesn't understand the value of CMH. They know it's there, but talk about the value of CMH and why it's so important for those that may be watching that don't know nothing about CMH. Like, what's CMH, and all that.
Sure. Community mental health is, in the past, has always been specific for those who have the most severe mental illness. And so it's really a resource for the community, those who are on Medicaid, non-insured, to be able to come get services for mental health and substance use disorders. And we're able to provide that now through being it's a CCBHC, Certified Community Behavioral Health Clinic, allows us to actually offer not to just the most severe, but to anyone in the community who even has a mild to moderate diagnosis.
Oh,
There's 9 services that are offered to that population. And so it's really a resource for the community who's in need. And if we aren't the right person, we're more than happy to help link and coordinate, get you connected to those right resources.
Crystal, not to put you on the spot, but do you have the 9 services memorized?
No, but I have a cheat sheet. I do
okay,
have it
there we
memorized.
go.
I have it memorized, but sometimes I have to count on my fingers if I,
Sometimes we need cheat sheets. Sometimes we need them. It's all
Yeah.
good.
So we provide crisis mental health services. We provide screening and assessment and diagnosis, person-centered planning treatment, outpatient mental health, outpatient clinic primary care screening. So that's to do with health, physical health, targeted case management, psychiatric rehabilitation services, which is our clubhouse,
Hey.
peer support services, and services for our veterans.
Oh, wow. Wow.
Awesome.
Wow.
I know services for our veterans is one of the things that we wanted you to talk about today. When you say outpatient mental health, I'm going to give you a scenario, and then I want to ask you to just kind of walk through what you would do for second and third. Is that okay?
Sure.
So I know that we have a large amount of community members who might be taking medication, and for some reason medication stops working and they have symptoms. If they want to get on the front end of taking care of that situation without being hospitalized, what would you recommend they do? Or maybe a family member encourage them to do?
Sure. So I would recommend that they call our access line, which is 734-243-7340. That line, it can actually be called 24 hours a day, and you'll either be connected to our access department or to after hours, our crisis after hours. And I would call that line, request services, and then they would meet with an access person who would do a screening and help determine what is the best route of care. So is it community mental health? Is it somewhere else? Say it is community mental health, then they would schedule what's known as a BPS, a biopsychosocial assessment. And that's really where we go through, we talk about your needs, your strengths, etc., and really determine what the best course is. And then refer you to most likely a case manager. Targeted case management is our biggest service offered here. And so connect you with that case manager, who would then do what is called an IPOS, an individual plan of service. That's where the person-centered planning comes in, where we sit down, we talk about your interests, what your goals are, how we get there, because obviously how I get to a goal versus how you get to a goal can look completely different. So we really want it to be in how the person feels would be best suited for them. And then treatment would start at that aspect. Now, if they have, I believe you said medications, we'd also connect you with our psychiatry department. And so that would all be a part of that person-centered plan.
Okay, wonderful.
Nice.
Thanks. For veteran services, I'm just playing like I don't know anything. So could you please tell us all about what CMH offers for veteran services?
Yes. So as of 10/1 of 2023, that was one of the services that we offered. Now we could treat veterans in the past, but this really opens it up to us being a part of the CCBHC more. So we actually have a memorandum of understanding with the VA, which is exciting. And so somebody comes in, they need, they're identified as a veteran. There's a couple of things that we look at. Have they declined VA services, and are they ineligible for VA services? If that is the case, then we will help provide service. We'll go through the same process that I just explained. But we also link and coordinate. So say they come to us, we know that they're already connected to the VA, then we're going to help continue that coordination. there's some guidelines for us that, it's if they're part of the U.S. Armed Forces and they're veterans and they're located 50 miles or more from a military treatment facility, or a veteran who lives more than 40 miles from a VA medical facility, then we can provide that service. But they can choose to come to community mental health too. And we'll provide the same array. We'll offer mental health services, SUD services. We'll do the psychiatric services as needed. So the whole array for them.
Okay. So if it's, I love that you mentioned that veterans who don't receive services. I know that there are a lot of people, I shouldn't say a lot, but I'm sure there's a pretty big group of people who end up being discharged, but not with the services because of how they discharge. And sometimes they may discharge because they're having some type of mental health issue. So what happens if they come to you and they aren't eligible for veteran services, but they are a veteran?
So when I say ineligible for veteran services, I'm referencing through the VA. So they would be then eligible for our services because it is part of the CCBHC and it is one of the services we're required to provide.
Okay. Okay.
You know, that's so important. I mean, a lot of times you hear a lot of people. Well, one thing that gets me, I like to have conversations. This is what I like to have. You know, Steph, you could witness to this. That people always say, people aren't doing this, they aren't doing that, they ain't got nothing going on for our veterans. They don't have this and that. They just be talking. So to hear this, that you guys have something for our veterans. And again, I tell people all the time, look, we can provide and give you the necessary resources that's available to you, but it's up to you to take that step and say, I need help and I need these resources, right? Awareness is one thing, but going out there to get it is another thing. So with that being said, Crystal, how many people actually come there on their own validity to say, I need help? Is it more they come to themselves or is someone else pushing them in that direction and advocating on their behalf? What do you see more of?
I would say I see more of people coming seeking help, whether it's parents for their kids. We have a big IDD population, but there are times I don't have a percentage,
right?
But if I would guess, I would say probably 80% come asking for services, 20% maybe the other route where somebody else calls on their behalf and then they get connected.
What's IDD stand for, Crystal?
Intellectual developmental disability. I've been trying not to use the acronyms.
That's okay.
It's all good.
So let me also say, you asked about veteran services. I think one important aspect of veteran services is having peers. One of the services we offer is the peer service, and that is someone with lived experience. And I wanted to add that it's really hard for veterans a lot of the time to reach out and ask for help. But when you have a peer who has similar life experiences, it's much more easier to have that conversation because they can relate to that. Not only do we have a peer who has veterans serve or lived experience with as a veteran, but we also have a therapist. And so I think that's really valuable because you have somebody who's possibly gone through something very similar, right? Everybody's story is different, but they've been there. They can relate. We also have it's called PHP, our prepaid inpatient health plan that we are under has a veteran navigator. And so that person also helps link and coordinate to mental health services, substance use services, housing, anything that person is finds challenging, they're able to help either connect them to Monroe or maybe other services depending on where they call from.
That's awesome.
Let me ask you this. If someone says, Crystal, hey, Lisa, I have a problem. I have a serious problem. I know I have a mental health problem. However, I don't have any insurance. All right. Which direction would you point them into, and or could you guys help? I don't know what the laws are, or in that situation, but how does that, or has that happened? And if it has, what do you do?
So for those who are not insured, there are specific services like crisis services we will always provide,
Hmm.
right? If they're at the hospital and they need to be pre-screened and they need to be placed inpatient hospitalization, we will always provide that. If somebody is in crisis, we always help provide that service. The other thing is with the CCBHC, that allows us to provide those 9 core services that I'd mentioned. Whether you're insured or not. Now, part of our goal, linking and coordinating, is trying to help somebody obtain insurance, right? Whether it's Medicaid or whatever it may be, we try to help link and coordinate that piece.
And Medicaid does go back 6 months, right? Like if you end
Correct.
up being eligible for it, but you don't have it, once you apply for it and you receive it, it goes back 6 months and pays bills from
Yes.
months prior. Did you
Oh,
know that? Isn't that cool?
yeah, I didn't know that.
Yeah,
Interesting.
it's very interesting. So, Crystal, October is World Mental Health Month, right? World Mental Health Awareness Month. Is that how it is explained?
I believe so, yes.
Okay.
We always celebrate in May because that's
Mhm.
Mental Health Awareness Month also, but yes.
Okay, okay. I just want to make sure I had both of those right. So that's when you celebrate in May, and then in October you try to make people more aware, and you have a town hall, that kind of thing. Is there
Correct.
anything else you guys are doing in terms of events that goes along with this month?
Hmm, I don't think we have anything else going on this month.
Okay. Okay. I was thinking about some other services that people are probably curious about. So for veterans and then also for addictions, like how can people identify that they possibly have a problem with substance use?
So I would say if someone has mental health or using substances and it negatively impacts their day-to-day functioning,
Mhm.
then that may be a time when you need to call for help and seek services.
Okay.
So it's
That would be
when
the
you
same way. Like
what's that?
they would call the community mental health line, and they would set them up with an interview with Access the same way.
Correct. And we actually have someone specifically that does all of our substance use disorder screenings.
Okay. Okay. I like to get that out there because I'm a marriage specialist, like counselor at the Willow Center in Toledo. And I am surprised at how much, like, for example, alcohol is affecting families, because I know that's our topic today, is how we can help families and we can help veterans. I'm always surprised at how much alcohol especially seems to be affecting families. Yet it feels like the family kind of realizes it on the back end. And so I'll mention something like what you said, where if it's affecting your day-to-day relationships, and affecting your family negatively, it might be something to consider. So if they get a screening at community mental health, then what is available to them in the community that we direct them towards?
Sure. So it just depends on their level. Everything is based on level of care and medical necessity. And so there's outpatient services. There is residential care. So, to help detox, all of that. So it just really depends on what level of care that they're needing.
Okay. Okay, awesome. And then to stay on the topic of families, just because I'm an educator, like what if there's a family that has maybe a child that they can tell, like their principal is recommending that they consider receiving services or checking to see if they need services or something like that. How does that go? And how do we help families because we're a CCBHC?
So the same way they would call our access number, that 734 243-7340 number, and they would inquire about services for their child. It would be the same process. They would go through a screening. If they're eligible for services with us, that whole biopsychosocial, get connected to a worker, etc.
What is biopsychosocial? Can you explain that?
Sure, that is the assessment where We really look at all life domains and figure out what parts, when I said about your day-to-day functioning is impaired. So let's look at exactly what is being impaired and how it's being impaired. And so that assessment then helps lead us to know, you know, think about, okay, well, these are some of the goals then maybe the family should work on. The family can say, this impacts them going to school every day. They can't focus. And then, so then you get to the IPOS time and you say, oh, you mentioned that focusing in school was a difficulty. Would you like a goal around that? And then the family can kind of decide. And sometimes families automatically know going in, I need help. They need to focus in school. And so it's really led, like I said, by that person-centered process or family-driven process.
And then perhaps a child might be able to get like a psychiatric appointment and discuss medication and things like that as well through CMH.
Yes.
Okay. Okay, that's great to know.
And we have therapists, we have kids programs. There's several specialties. The state is very heavily on some evidence-based practices. And so there's a lot of training that our children's department have specific, because there are so many treatment modalities for kids.
That's great.
Is CMH open 24 hours or is there a specific time where they can get a hold of you guys?
Sure. So our building is not open 24 hours. It is open from 8 until 5:30, 6 o'clock, just depending if you have an appointment scheduled. But we do have a 24-hour after hours line. Like I said, that same phone number will direct you to the after hours. However, we do offer our crisis services, our mobile crisis team is available 24/7, 365 days a year. That service has been, we've implemented it in July 1st of 2023, and then we went 24/7 on 10/1 of 23. Anyone could call the after hours line, and our staff there will assess, and if they feel that crisis mobile is needed, they will deploy the crisis mobile team. But also we have a partnership with law enforcement, and law enforcement has our line directly. So if they are out, if they run into someone who they feel needs mental health services, they can call our crisis mobile team directly and have them deployed.
I love that.
And they really come out, they provide a service, they kind of assess the situation. A lot of the time it is just being able to de-escalate, pull, whoever the person is, pull them away from maybe the family members, have somebody, a neutral party to talk with. And then they do not have to be a CMH recipient at that time. They can not have had any services at all. And we can help connect them with CMH services, or we can help connect them with other resources that they're interested into. I know since we're focusing on veterans, I will say one of our very first success stories with Crisis Mobile was actually for a veteran. A family member called and said, we're kind of in crisis right now. Explain the situation. Our team went out and actually got them connected with the VA and got them enrolled in services. And so we even received a thank you from that family, because they, when you're in the moment, sometimes you don't realize what's going on, and you have that one call for help, and we helped. We were able to link and connect to the correct services, and the last we knew, that family was doing well.
Fantastic.
Oh, and it's important to note that historically, the majority of people are in the public are undiagnosed. And you usually don't get that first diagnosis until your first interaction with law enforcement or incarceration. So that's when the first time many people get actually diagnosed with a mental illness. So CMH did partner up with the Sheriff's Department and the Police Department. So now if the Sheriff's Department goes out on a call or they notice something, now they write referrals and they get that to us, and then we follow up. So that's important, and it's probably increasing our ability to diagnose people before they get severe. So if you can stop it or try to slow it down early, doing preventative measures, that helps. So this is a new program that Sheriff Goodenough instituted and working with CMH. So that has increased our ability to help more people.
Yeah, and Stefan, you mentioned the referral. So we do have a universal referral form. Kind of came out of our coalition, correct? The sheriff's office started doing this referral form. As Stefan said, they're out in the community, they observed something, they were sending referrals to us. Well, we expanded that this past year and a half, and we have 10 providers who also make referrals, and we're adding 2 more in this current fiscal year as of right now. And we responded last year to 388 referrals that we
Wow.
received between law enforcement and our community partners.
Wow. That
And
made a
so
tremendous
that
difference. Wow.
it's one of those, I mean, you can call somebody and they may not want services, but it's still an avenue. It's still an opportunity to do outreach and to try to reach someone who may be struggling and need those services. And sometimes it's just that phone call, right? Just that follow-up to ensure, like, hey, we received this referral. Is everything okay? Can we help you in any way?
Wow.
I get to talk to a lot of people, Crystal, at school, and I know your Crisis Mobile actually drove all the way out to it was a community right before Toledo that we service, to just engage someone who was having a mental health crisis. And I think they went out 2 or 3 times, but by the time they were out the third time, it built trust in the person to access services, and they were able to get services, medication, that kind of thing, and they're doing very well. So.
Oh, awesome. I'm so glad to hear that. Part of our Crisis Mobile, we have follow-up protocol too. We follow up within 24 hours and then within 7 days. And so our goal is really to help connect them to services. And if they choose not to go with us, that's okay. But we want to connect them with services somewhere and help them, to continue to stabilize and have those supports.
That's why I would really, Erin, really quick to put in a shameless plug for the clubhouse, which is now the River Raisin Clubhouse. It's also a wonderful place to come in, and they have a grant now too, where you don't have to receive Medicaid to go in for services. They have lunch together. If someone's looking to have lunch with someone, or lunch with a group of people feeling isolated, that kind of thing, they can come in the morning or call in the morning and just say, hey, I'd like to have lunch with people. And they pay $2 and they can come in and eat a really great meal for lunch, meet people who have also been able to overcome maybe some mental health issues, and they will get connected to service. I know Stefan just told me, Stefan's the director. I think we've said that a couple of times, but Stefan just was telling me about some people who came in because of us getting this grant where we can serve even people who do not have Medicaid. They came in, they received help getting connected to Medicaid, and now they don't qualify under the grant. They qualify as a Medicaid recipient to come into the clubhouse, and they're coming in all the time. So I love what we do in community mental health.
And then the important thing is that, Erin, is that the clubhouse model is evidence-based practice. So what that means basically is we have empirical evidence that shows that we decrease recidivism in hospitals, we decrease incarceration, we decrease homelessness. So all these things that we do in community mental health is evidence-based, and showing that our interventions do help. So that's what's important about evidence-based practices in CMH.
And what's a clubhouse member? Always a clubhouse member, right?
Exactly.
I love that. And this is the reason why we do this type of show. The reason why we have our show in the first place, so we can make you aware of the amount of resources that are available to you. And I'm so proud of the work that we've done. If there's a shameless plug, I mean, come on. I mean, we've been doing this for 8 years now, and I'm just so proud that we continue to do this, Chantel, Stefan, Bronco. And I'm so glad that people reach out to us and are excited or happy that we have this platform to have people like Crystal on, Lisa on, and all those in our community on, part of the coalition. It's just I learn so much more every time I talk to people, and it's so awesome how this is, getting out to the community. Resources are important, but you have to make the first step. Like Stefan said, being diagnosed is the first step. And once you're diagnosed, then more help can come to you. So I'm just so proud to be a part of this group, man. I love you all.
Love you too. Thanks, Crystal.
Thanks for having me.
When
Yeah,
we
and
ain't
you
done-
know what? The greatest thing about our show, though, Vicey Gray, with the Community Coalition, is that we welcome anybody,
anybody.
and we don't have to agree, but
Dude.
we'll listen. We'll sit and
In fact,
listen.
I like when you don't
You know what I
agree.
mean?
Have a conversation.
Have a civil discourse. You know what I mean? That's what we're about.
I love
We've
it.
become far more civil over the 8 years. I'll just go ahead and say I've become far more civil over the last 8 years. I
love
like
it, though.
to say that anyway.
You know, because it just shows we're all human. We are human. We all have perspectives. We all have different ways that we grew up. We have different ways, and we can. And the beautiful thing about people is we can evolve. We can get better through conversations. We can get better. We don't have to. We can agree to disagree without being disrespectful, right? And that I always say that. You know, we can. It's okay to disagree. I don't want to be right all the time. You know what I mean? You hear just I say I don't want to be right all the time, right? You heard that, right?
There's an art to it. I'm getting better and better. Picasso is the goal at the end. I have to go, you guys. It's great to see you.
Appreciate it, y'all.
And with that being said, I'm gonna leave you with love and respect. Come on, y'all. Steph
And unity. Oh, go ahead, Chantel.
And you need to inspire change.
and Steph. In order to
In
see
order to see
clearly,
clearly, you have to see gray.
We
See
see
gray.
gray.
You.
do you. Peace. Well, love. I'll see you later, Crystal. All right. Peace.
Bye.
Good stuff.